Welcome to my channel. So this is about getting leukemia, specifically AML. I'm just going to start off by telling you some symptoms that I had, and then we'll go over the diagnosis, the bone marrow biopsy, you have cancer, what now, hospitalization, chemo, losing your hair. I'm going to do some videos. When I first got leukemia, I was scared. First thing I did was went to YouTube and searched for answers, and there wasn't a whole lot. What I was looking for was a video that told me, okay, you have leukemia, this is what is going to happen to you. I want to help somebody out there that is getting ready to go through treatment, and I want to answer your questions and tell you basically how to handle it. I knew I was going to lose my hair. That was a given, and for a woman it's really hard. I'm not a man, and I don't know how you all feel, but I would imagine shaving your head as a male is not as devastating as it is for a woman, because our hair is everything to a lot of women. So I want to go over wig selection and wig care, because you do have to wash a wig just like you wash your hair. Not as often, but you know, wig selection basically. At the back of your neck is where your hair, the wig is going to rub against. And with normal human hair, you can just brush it, but with a wig, it gets frayed like, you know, acrylic hair. So I'm going to go over wigs, how to select one that's not going to fray like that. And how to bring back a wig to life that's looking pretty ragged. I'm going to also go over recovery and diet changes. One thing that I learned, I lost so much weight. You know, chemo makes you sick and makes you lose your appetite anyway. And my spleen was so large that it was pushing against my stomach. So, you know, I'd eat a bite or two of something and then I was full. So, anyway, I'll go through all that with the diet changes and how cancer loves sugar. I'm not a vegan, and I'm not a raw food person. I'm not a workout freak or anything like that. I'm just a normal person that got cancer, and I ate fast food, and I didn't take care of myself like I should have. So let's get started. The symptoms that I had. I worked in IT. Still do. I started getting shooting pain down my back. Like I would bend down in the shower to get soap, and it would shoot pain down my back, right? Another thing, my neck hurt. Like, you know how you sleep on your neck wrong, and then the next day it's sore and you can't really move your head? Well, I could not move my head. I would get into the car and literally have to put the seat all the way forward because my back hurt. So that is one thing, and now in hindsight I know that happened because my bone marrow was so full that it was starting to ache. You know, my bones were aching. Another symptom I had was fatigue. Now, as women and mothers and working women, we're tired anyway, but this was different. I felt like I had the flu. I just woke up in the morning and felt like crap, and it took everything I had to get ready and go to work. And I went to work every day. I didn't call in. Another telltale sign of leukemia is fever. Every day at 2:00 p.m. I would start getting a fever. And I could feel it. I could feel my head start getting hot, and I just didn't feel right. And so I got these. $10 at Walmart or Walgreens, and it's digital. You just put it in your mouth, and 30 seconds later it tells you your temperature. I would have 102 fever every day, every single day. So the shooting pain down my back, not being able to turn my head, the fevers, and the fatigue. Or a lot of leukemia patients have bleeding gums when they brush their teeth. I didn't have that. A lot of them bruise easily. I really didn't have that either. So, diagnosis. I made an appointment with my family doctor. And even if you're having these symptoms and you don't have leukemia, still go to the doctor and ask them for a blood test, because a complete blood count can tell your doctor a lot about what's going on inside your body. So I went to my family doctor and he had me do a blood test. He called me the next day and he said, Karen, I am seeing something in your blood that normal healthy people don't really have, and they're called blasts, BLASTS. And I'm concerned. So now this doesn't mean you have cancer, he said. And I thought, okay, right. And he said, I'm going to give a referral to the oncologist. And I'm thinking, oncologist? That's a cancer doctor. So as soon as we got off the phone, I Googled blasts and leukemia. I knew I had it. I knew I had cancer. So that night, I got home and I just cried and I cried. I thought I was going to die. When you hear that you have cancer, it's a death sentence to most people, to a lot of people. You just have to have that fighting you that you're not going to let that cancer win, and you're going to do everything you can to win and to beat this. So the next day I went to the oncologist appointment, and he did a bone marrow biopsy. And that, you can Google that and look at the process on YouTube. But if you're about to have a bone marrow biopsy, I don't suggest YouTubing that, because it looks brutal, okay? It looks barbaric, because they actually put a long needle into your hip, into the bone, and then they aspirate your bone marrow liquid, and it's not pleasant. But the doctor gave me an IV of Valium, and he did it manually. But a lot of times they'll send you to a diagnostic center where they'll put you out on fentanyl and Versed, which is a erase your memory type drug, right? And then you won't remember any of it. And that's the kind of biopsy you want to have, trust me. So the biopsy did confirm that I have AML, acute myeloid leukemia. And what that means is in your bloodstream, I had too many platelets. My platelets were, and platelets, what they do is they allow your body to heal, okay? If you don't have enough platelets, you'll bruise really easily. So if you don't have enough red blood cells, you're going to feel super, super tired, and you're going to get tired just walking to the bathroom from your living room. So I won't go all the technical aspect of it. I may do another video that explains how leukemia works, but basically what it's doing is it's in your bone marrow, and all these cells are the normal cells. They should be fully mature and doing their own thing, but the leukemia cells, they are crowding all of the normal good cells. They're crowding them, and they're like babies. They're immature and they don't develop. So then your regular cells say, hey, we don't have room for you. So the leukemia cells spill into your bloodstream. And that's what the blasts are. But so I had the biopsy, and the doctor said that I had AML, and he said, you need to be admitted right away. Okay. So I was admitted I was admitted that afternoon. Yeah, I went right to the hospital from the doctor's office, and they checked me in, and they started chemo the very next morning. The first day or two when you're taking chemo, you're not really sick. It hasn't hit you yet. But what they'll do is, I don't know if you can see this, but this is my port. And they surgically put this in, and what the nurse will do is she will access this and put a needle through it and then bandage it up. And then they can put your chemo, and then they can put like fluids in the other. There's two that go into your port. Or you can have something in your inner arm, which is called a, gosh, I can't remember the name of it off the top of my head. That's harder, and it's really hard to shower in it. So if you have the option, I would suggest getting a port. It's a lot easier. So they put that in. They started chemo the next morning. I was still having high fevers at this point, and my fever would break in the middle of the night, and my pillow would be soaked. So I really don't remember the first 2 to 3 days in the hospital, because it was a lot, and I was out of it. The doctor told me that my bloodstream had 80% blasts and leukemia cells. 80% of my bloodstream was crowded with leukemia cells. So I probably would not have lived that much longer. So, like I said earlier, if you are having these symptoms, please go to your primary doctor and have him or her do a blood sample, because that can tell them a lot. So I will stop here. I will start doing different videos for chemo and all my problems in the hospital. I'm going to show pictures of me losing all my hair and me being bald. I'm going to show pictures of my bruising. And another thing that you get with leukemia is Pitucci. It's little red dots all over, and I'll show you pictures of me. But yeah, if you're interested, just look at the other videos, and I really hope I help somebody. If you have any questions, I will be happy to try to answer them for you as a patient's perspective. I am not a medical person. I'm not trained in the medical field. I'm IT, so I can fix a computer that's sick, but I only know myself. And if I can help anybody out there that's suffering through this and scared, that's what I want to do. So.